Okay. Hi, everyone. I'm Dr. Nina back for another TOVA Tuesday episode. I am so excited to have here today Mrs. Patricia Allen, Nurse Patricia Allen, who is also a serial entrepreneur, talk about her school. She actually has a school in Florida called Abundant Life School of Nursing. And for all of you who don't know that healthcare the sector is growing at such a demand. And the Department of Labor estimates that 2.4 million jobs are going to be created by 2029. So all of those of you have maybe lost your job due to the COVID pandemic, guess what? There's still opportunities available for you. Now is the time to act. TOVA Tuesday is all about talking to healthcare providers about wellness topics, all kinds of matters to help you improve your overall quality of life. Well, one way to do that is to make sure you can have a job, that you can be employed and be paid a living wage. And so here today, I'm going to be talking to Mrs. Patricia Allen, owner of Abundant Life School of Nursing. Welcome to TOVA Tuesday. How are you today?
I'm fine. Thank you very much for asking.
So can you tell us a little bit about yourself? You're a nurse like me?
Yes, I've been a registered nurse since 2008. I got into nursing because there was a lot of my family members that were getting sick, and I just wanted to be able to help them. And nursing has provided me with so many opportunities, and I want to be able to offer those opportunities to others. I've never ever, been unemployed. I've always been able to help people around me. And, I actually teach CPR. I teach first aid. I teach bloodborne pathogen. I teach classes now, but I thought, how could I enrich my community? And I said, let's kick it up a notch. And I have a wonderful mentor, and she really helped me, with the program and the curriculum, and basically teaching me that not everybody's going to start at the same level, and some people are going to come in a little bit higher, a little bit lower, but it's our job as the nurses to teach them and get everybody up to a proficient level. So I really look forward to bringing high school students in, their senior year, and, showing them, okay, well, when you graduate, you could go 12 months, go directly into the job market. Right now, I've seen LPNs, making $30-$40 an hour, and that's not even an understatement. So you could come out of high school and get your LPN and still work through college for something else, and or you can if you were just displaced by another career, you can jump right back into the job market. 1 year is not that much time to sacrifice to make that kind of money. So, and not even just from a money standpoint, just the fact that you're helping other people with the COVID going on. There's been so much strife. So just being a part of, the relief effort, I know that I have to protect myself, and I do, but I do like getting out into the population and being able to assist, the elderly people or vulnerable people in my community.
Right. And I think that's fantastic. And being a nurse, like you said, there's not a time I can think of that many people of in the nursing profession are unemployed, especially during this time when the demand for nurses is at its all-time high. But tell me a little bit about why you said, okay, I want to take that leap of faith. You must have had to put in so much time to develop a curriculum, to build a school. That's a lot of rigor and a lot of work. And you're not affiliated with a public institution, a university. You're an independent school of nursing. Tell us about that.
Well, we do have a proctoring school, so we are affiliated with another school. But the reason I decided to kind of step out is because I love educating people, and nursing is like something really, really dear to my heart. And I was actually sitting next to a girl in one of my classes, one of my recertifications for CPR. And I told her, she was very smart. So I said, you ever want to start an LPN school? And she said, my mom owns one. So like how would I even have to turn to somebody? It was, I didn't know her. It was the first class. So just that, when that happened, I said, let me go for it. And as her mom mentored me, and she has helped me a lot as well. But just getting away from that mindset that, you go to school and, your teachers, they're gonna be barking down your throat, and if you do this, you do that, and you're out of the program. When I say these women, they have coached, and I've seen them, take time to understand, and so I think that just watching them has made the transition a lot easier for me. But my heart was yearning for it, and they kind of they fed me what I needed, and they're still, a continued asset to me. But it's just, we want to get away from, when you go to school, you're scared of the teacher, because the teacher's going to tell you that you don't know what you're doing. And yeah. So, but, sometimes when you make that first mistake, you don't do it again,
Right. You have to learn.
We understand that that's going to happen. And so we're trying to get people out of that, they're so scared to even try school. Some people have told me they're scared to even attempt it because they don't have study skills. They don't have that. But, if you're dealing with a more accepting school, we want you to come in and, let's try to work on those skills before you just count yourself out. I was just talking to a potential student. She told me, I can't study. So I said, well, come around with me for the day and let's see what happens. So I told her, I gave her a notebook. I said, write down every task I give you. And by the end of the day, there was nothing written down. And I said, that's why you're not a good student, because for something to be committed to your long-term memory, you have to see it 15 times. And you are just trying to memorize things, but you have to write it. You have to think it, you have to say it. Even saying it helps with that feedback loop. So, but when I told her that, then she's like, oh, so it makes sense why I'm not a good student. So now she writes down everything and everything works so much better. But if I would have just been like, oh, don't even think about going to school if if you don't have good study skills, then that would have been potential student lost.
Right, exactly. So it appears that you have a very nurturing environment that you offer to your students, what I think is fantastic. I do have a couple more guests that are coming on. Can you introduce yourself?
Hi guys, Sharina, I'm here.
Hi. And Sharina, are you in the school or are you one of the directors? Introduce yourself. Yes.
Hi. No, I'm not the director. I'm actually just a talent. I just came on to play a role as Pamela, and I'm just excited to do the part.
Okay.
Thank you so much.
Thank you for coming today.
Thank you.
So we were just talking about the School of Nursing that Mrs. Patricia Allen, Nurse Allen, has created, and the nurturing environment that she tries to inculcate in her students. Though you seem like you're very strict, you want your students to learn, and you want to put out students that are going to provide high quality care to their clients. Would you agree to that?
Yes, I am 100%, big on curriculum and them doing what they need to do. Because at the end of the day, I tell people, if I just pass you, you're not going to pass on your state boards. So There's no point in, you trying to skate by with me, because ultimately, you have to take your state board. And so you should try to really learn it in its entirety, because in the past, I don't know how it is with COVID, you only get like 2 times to take your state board before, you just lost your money.
Right, exactly. You want them to pass. You want them to do well. So nursing isn't easy. It does require rigor. It requires studying. It requires to develop good clinical skills. And that's very important as they move on in their career and whatever they do. But so I would like you to also talk about some of the other training courses you offer. I have here nursing assistant, patient care assistant. Wow, that's fantastic.
Yes, just gearing people up to that next step. The nurse's aide, I started out as, I didn't even believe this because I looked at my little nursing assistant license, and it said like 2006 I had it from, and so I was like, I had that CNA, and that's where I got so much experience, even in dealing with the culture of nurses and, being around the doctor. And, I'd see some nurses go and tell the doctor something, and he'd say, well, why'd you do this? Or why'd you do that? So then I'd be like, okay, so if I ever become a nurse, I'm not going to do this. I'm not going to do that. And I, even want the patients, learning to take care of them before you, get into LPN school. A very, very good trial is to see, let me try to become a CNA and see if this is something that I really, really am passionate about. So, I always encourage people to take baby steps, because sometimes people just want to jump from A to Z, but you miss everything in between, and then you kind of wonder, okay, what did I do? So nursing assistant is a wonderful way to get into healthcare. Like I say, right now during COVID, everything is so profitable. Even nursing assistants, they're getting out here, they're making really good money with the, there's a fast track course, and then there's a 6-week course. So, I mean, with those time frames, to go out and actually be able to earn a substantial living, I definitely think it's worth trying either the LPN, or if you're not familiar with healthcare, then definitely CNA. And patient care tech, they work predominantly in the hospital setting, but again, very good precursors to nursing. If you don't kind of know if this is what I want to do, I don't want to invest a whole year, it's not something that I'm going to want to stick with, then I would definitely advise someone to take the CNA or the PCT class.
And you said it's only how many weeks long that they would have to invest
for
their time?
For the CNA, there's a fast track, and that one, we're still coming up with some of the dates for that one, but the normal standard class is 6 weeks.
Wow, that's fantastic. That is fantastic.
Yeah. And
so just 6 weeks of your life, come on, exactly. You can do it.
Exactly. And it gives you that test taking practice. Exactly. Because you do have to go and take your, sit for your boards. And, sometimes people, in that situation, they say, oh, I do need, I understood the whole class, but I'm just not a good test taker. Now you understand a little bit more about yourself. So that way, you can say, okay, I need to work on my test taking skills. It's not so much I don't retain the knowledge. I need to go to sleep, maybe a couple hours early before I take the test. Or, I need to, brush up a little bit, but you just learn a little bit more about yourself and taking those other classes.
What were some of the challenges? Or like, I'm a social entrepreneur, so I developed programs, I developed intellectual capital and intellectual property to improve the lives of people, solve issues in the environment and social issues. You're a serial entrepreneur. What makes that different?
Mm-hmm. I have a knack for business. Like, I can look at something and say, oh, okay, well, there's a need, or, I can focus on this, and I can take this idea to a widespread, and, I can make it profitable. I'm really, really good. I started out as far as business. I was an auditor for the state. And then I opened a consulting company after I resigned from that position. So I consulted with businesses, on passing audits. And then after that, I opened my agency, and I started taking, some of the same clients that I knew from before. But all, of course, I resigned from one place before moving on to the next. And, I let my agency grow. Right now, we have over 100 nurses that are out in the community that, are touching people, healing people. They are the best people I've ever met. Some of them, it's a hurricane, and they're dodging down limbs because they don't want their clients to not have care. And COVID, this has really tested healthcare workers, and they have not flinched. So, I started taking on all those clients, and I was teaching the classes. And so now the natural progression of, my work, because there's so many people that, we passively teach, and talking to a new family, their child or their adult, they may have a new apparatus, and then you have to teach the nurses about that. So we're doing all this passive teaching, and, the nurses, they love it. So I said, let's formalize it a little bit and really be able to help people. I was a pregnant teenager. I got 16 when I got pregnant. And that's why I took my CNA class, and I bought a new car for myself my senior year. I graduated early, and, I nursing has been such a foundation for me. Now I want to be able to teach people so that way they have the same security. And being a serial entrepreneur, right now, me and my best friend, we have a wellness, we have a wellness spa that we are getting together, and just everything involving health, wellness, the body. I'm there for it.
Wow. And it just seems like you just expand onto your business model. And so you're just kind of moving in different directions, but you have leverage from other areas in which you're drawing and expanding your skill sets in many different directions. It seems like that's very commendable, and I'm learning so much as well. Mm-hmm. But one thing I want to say is that your mission of your school is just it's rather than just being nurturing, you're also preparing to students to be competent, caring, and well-trained individuals. Can you talk about the mission and the vision of the Abundant Life School of Nursing? What makes your program unique?
Like I said, with our program, we want to kind of lead by example. We can't tell people, oh, go out and, be this compassionate caregiver. And, when they're in school, they're learning, no, and don't do this and don't sit like that. And, and so we want to lead by example. We want to show you, okay, you messed up one time, this is someone's life, but, learn how to do it correctly, and, you'll pass to the next stage. We do have a remediation that my counterpart, she does the remediation. So if we can't get your skills up, you're not going to fail out. We'll remediate you. And I mean, at some point, if it's not going to work, it's not going to work. But in typical programs, if, you just can't come up to par, you just fail out. But, we do have a remediation program where we will take you back to adding and subtracting, and, just really try to work with you to get your skills back up. So that way, you can rejoin, probably not your same class, but you could, start. Me personally, people ask me, am I super smart? I am not. I'm persistent. I will just keep doing things. And then it could take me over the span of 5 or 6 years to do something. But if it's something I really want to do, I don't really mind. It's, I think the school, it started taking shape maybe in 17, 18, something like that. And I was 21. and this is when we're bringing in all of our introductory. So it took a while, the process, but I'm just a persistent person, and I want to teach persistence. If you really want it, then you have to just keep going.
Absolutely. And I think that's the quality of entrepreneurs. Like, we just don't give up. We keep grinding. If one door closes, we'll figure out another way to open another door, and we just keep moving forward. Can you tell us how we can visit your school and find out more information about your programs?
Yes. Well, right now, We are doing like Zooms. We're not taking anybody in. We're kind of waiting on the CDC and, just seeing where we're at with vaccines. But you can go to the website, which is listed, and then we'll be giving updates because some of the instructors, they are in line for vaccines because they're, we're in Florida. We're a little retired down here. So they don't feel comfortable right now with people walking in off the street. So we are, conducting Zoom
classes
meetings,
and
that kind of thing for right now. And then once everyone's vaccinated and we can be open free, then we'll carry on from there.
Okay, but they can still get information about your programs, and if they want to enroll in your programs,
they can still get information.
Still reach out.
They can still reach out. We are starting the CNA class May 1st. So hopefully by then everybody has their vaccines and we'll start in person. That's, our number one goal is to start in person. It is an in-person program. So we're just keeping our fingers crossed because, the vaccination schedule is moving pretty quickly here where, it's happening. So as updates come available, they'll be on the website.
Very good. Very good. And again, you can reach Abundant Life School of Nursing by calling 352-250-2748 or visit them on their website at www.abundantlifeschoolofnursing.org. I would also like to talk to you about, as a serial entrepreneur, you kind of look to see where the industry is going in certain directions. And I just happened to pull this up from the Department of Labor and found that they expect healthcare related fields to grow by 15% across the industry, which is faster than the national average. Astoundingly, the growth is expected to add about $2.4 million. Million workers, not $1 million. 2.4 million workers between 2019 and 2029. Wow. The demand for work is here. And here's our opportunity for our community to get into the healthcare industry. Can you talk about that and why there's such a big growth right now, you see?
Well, I think as far as where we're at now, COVID, of course, there's a lot of sick people and, they need care. I think definitely going in the future, health and wellness is booming right now. People are doing a lot of different treatments on themselves and they need they want guidance basically in how to stay younger. Before I was joked, before you would see a grandma and she had like one of those little wigs on and, she's pushing a walker. Now, where I live, you see grandma, she just got her boobs done and she's, with her little bikini top. People don't want to get old anymore. So they want guidance. They want people to tell them, hey, you can get this surgery or that surgery. And aside from plastic surgery and that kind of thing, wellness. People don't want to get old and sick and, have all those health problems. So preventative, there's plenty of, naturopathic professionals who are doing very well here, teaching people how to use herbs and different things and integrating that with traditional medicine. So it's all in the same, we don't want to die. Well, we have to.
We want to die with dignity and look good
and not,
going out.
And not prematurely.
Yes, quality of life.
Exactly. So I believe those numbers probably are going to, continue to rise for healthcare workers because there's a need. The public does, they want to take care of themselves. I think there's a bigger emphasis now, especially COVID. That's making a lot of people want to say, hey, I need to take care of myself. A lot of the people who were most susceptible had the pre-existing conditions. So, they were not able to, fare it as well as, just the typical healthy people. So with that, a lot of people are saying, okay, hey, I need to make contact with a primary care doctor. I need to see what my numbers are, and then I have this, I have that. And let me start working out. Let me start exercising. Although the gyms are still closed, there's plenty of people walking around. There's so much emphasis on, us getting ourselves healthy. So that way, we can live a long life.
Right. And also that our population is aging, so we'll need more services and healthcare providers
They
in
are.
the healthcare industry as well. So that is expected demand as well. I also just think too that, as we get older, we also want to have, for those who can afford concierge medical services as well, besides other types of surgical enhancements. And so even in COVID and with the technology constantly changing, people still want to live a good quality of life. And so the healthcare sector is in such in demand that nurses and nursing assistants and other workers will be in demand to take care of this aging population that are aging gracefully and with dignity.
Yeah.
Would you agree?
And I mean, like I said, here in Florida, grandmas, I don't see grandmas anymore. I see beautiful women, and they're out at the golf course all the time. Of course, this is pre-COVID. I don't really see that much anymore, but pre-COVID, they were very, mature individuals living their best lives. So us healthcare professionals will help them continue to do so.
Yes, yes. So what other sectors are actually growing besides nursing and other programs that you offer besides nursing assistants? You said patient care assistant techs. Any other areas in which or programs that you're looking at to build training programs for?
Right now I like to focus in. I want to have the quality. So if limiting the quantity, promotes a higher quality, then that's, what I'm aiming for. I want to specialize in my LPN, my CNA, and my PCT for now. And, we do offer phlebotomy. I worked in dialysis, and that was the only time I was able to access someone's blood. So I'm not very good with it. Those needles are so big, you got to be blind not to be able to access a fistula. So I like to be, skilled before I try to teach someone. And I know I could hire teachers as well for phlebotomy, but that's something, we will offer down the line, a straight phlebotomy course. I think it is built in to the LPN, but another instructor teaches it right now. So phlebotomy and EKG and, some of those other courses we will offer. But for right now, I'm focusing on my LPN, my CNA, and my PCT.
Awesome. Awesome. So we're going to be coming to a close soon with our TOVA Tuesday. I want to thank you so much for coming on and the great work you're doing in educating the next group of nurses and healthcare leaders that are actually out making a difference in our world today. I also wanted to share with our audience the healthcare professional training locally in the Philadelphia region, and I'm from Delaware. There's a lot of community colleges that offer nursing programs, from Delaware Tech University to University of Delaware, Delaware State University, private universities like Wilmington University, and there's still diploma nursing programs as well. We have one down in Lewis, Delaware. It's called the Margaret Rollins School of Nursing. So definitely seek out where you are, seek out a program. If you're interested in a field in healthcare, the time is right now. Yeah. Make a good living, good wages, hard work. But guess what? It can be very, very rewarding. Yeah. So I would like to let you end our TOVA Tuesday today. Do you have any other comments? I wish you well in your endeavors. We're definitely going to kind of follow you and see how you're doing in your school. And I'm sure that your students are just so grateful to have you and your colleagues as instructors. I always wanted to be in a nurturing and a supportive environment when I went to school, but we're here today and things can change for the better.
Yep. Well, I just, I just advise everyone, if you are interested in, pursuing a career in healthcare, you don't have to come to my school, go to wherever school is, close and local to you, but definitely jump in there, and don't be afraid. You may not do as well, you're interested, just keep at the persistent pace off. And even if you have it 4 or 5 times, just keep going. YouTube is a wonderful, wonderful resource. Every video you can think of for math, science, reading, go on YouTube, Google it, and just use that. I am actually working on a YouTube channel where I'll be showing people how to do nursing math. So stay looking at the website, and I'll publish that information. But nursing math related to the TEAS test, or just showing people that my little tricks that help me. I don't know if they'll help you, but hopefully that they will. If they don't, go to someone else's channel. If it's not me, long as you get it from somewhere.
Right. In the internet, you can get such a wealth of information as well. So there's no excuse. If you are persistent and you want to pursue a career in healthcare, you can do it. The opportunity is now. In closing, I just want to thank owner of Abundant Life School of Nursing, Nurse Patricia Allen, CEO, owner, and serial entrepreneuring, for coming on TOVA Tuesday today. I'm so encouraged by the work that you do, and knowing that you're putting out a pipeline of nurses and healthcare providers that are on the front line right now, saving lives and making people's lives better and of good quality. Thank you so much for coming on TOVA Health TV. I'm Dr. Nina Anderson. If you want to hear more about this episode, please visit us on Facebook and Instagram at TOVA Community Health. You can go to our TOVA Health TV channel on our YouTube channel to check out Nurse Patricia Allen, or hear more of our episodes from our fantastic healthcare professionals that are serving the community in so many ways. If you like this episode, please donate to our Cash App at $TOVA Health, or you can make a donation at PayPal at contact@tovacommunityhealth.org. Thank you so much for coming on TOVA Tuesday. I wish you much success in the work that you're doing. May God continue to bless you and your students.
Thank you. Same to you. You have a wonderful afternoon.
Take care.
Bye-bye.